Good afternoon. Thank you for joining us for the HPL seminar. It's a very nice day out there, so hopefully everyone got some sun or plans to get some after the seminar. Today we have the pleasure of hearing from Zachary McClean, who is our speaker for the day. And Zach is currently a PhD candidate here at the University of Calgary. He is supervised by Dr. Matt Jordan. And before starting his PhD here, he did an MKin degree, also at the University of Calgary, which was a course-based program focused on exercise physiology and in clinical and performance populations. Zach then went on to do an MSc degree in 2022 from the University of Calgary under the supervision of Dr. Jalal Abudarda, and he specialized in neurophysiological changes occurring during high-intensity interval training and blood flow restriction. Following from that, he started his PhD here in 2022 under the supervision of Dr. Matt Jordan. And now under that PhD, he is specializing in data-driven approaches to evaluate neuromuscular function in ACL injured athletes. Also, some fun facts about Zach. He thinks that he does not have fun facts, but he does enjoy spending time outdoors and spends as much of that time golfing as he can in the summer, which I'm sure everyone loves to do. And then he also is the player development sport performance coach for the Calgary Flames, which I think is pretty cool. So that should be part of your fun fact, Zach. He will be presenting his presentation titled Moving Beyond Asymmetry, Methods to Evaluate Neuromuscular Performance Following ACL Injury. Thank you, Zach.
Of course, thank you. So I'll just jump straight into it. To begin with, I think Nathan just presented from our lab, so getting lots of ACL content recently, which everybody will like, I'm sure. So a little bit of background information is that ACL injuries occur commonly, and they're not just isolated to one or two different sports. They're isolated, or they span a range of different sports. They impact females more than males, and they're common here at the university and university athletic setting, which will be relevant soon. What you might not know though is that ACL injuries aren't isolated to just the ACL. They often involve damage to secondary structures like the menisci or other ligaments and structures of the knee. They often require surgical reconstruction of the ACL, which is this invasive and complex procedure. And it involves taking a graft from maybe the hamstrings or the quadricep tendon to replace the previously ruptured ACL. And that rehabilitation process is extensive. It can take upwards of 9 to 12 months. This is a recent paper that just came out kind of questioning that 9-month time frame and saying that it could be potentially longer, and that aligns with a lot of the work that we've done in our lab. So it takes a long time to rehab, but even still, return to sport outcomes are fairly poor. In fact, the return to sport criteria is lacking, and there's no gold standard for when we should evaluate, when we should decide when an athlete's ready to return to sport. And when we do decide that, only 55% of athletes return to their previous competition level, which is a fairly low amount. In those athletes, re-injury risk is high. And actually, even by passing criteria for return to sport, this increases your risk for an ACL injury on the other leg by over 250%. So I'm sure that you can agree that you probably don't want an ACL injury to begin with, but if you do get one, the outcomes are poor. But what we often don't think of is that even after passing ACL return to sport criteria, athletes' performance in their sport is reduced, and this reduction can last upwards of 3 to 5 years, and some athletes never perform at the same level again. And that's kind of the focus of our lab and our lab group, is that we're interested in looking at the effects of ACL injury on whole body muscle mechanics and we think that this can help us gain some insight into the long-term performance deficits and provide trainers or rehabilitation experts with strategies to improve sport performance outcomes after ACL injury. So here's one example as to how this kind of is a relevant case study, is that like I said to you before, somewhere in the 9 to 12 month range is typically when athletes return back to sport. That's right in this area, and if we look at what a common couple of metrics are for evaluating return to sport readiness, we can kind of hone in on limb symmetry, or how different the two limbs are during a task, in this case jumping. And we use this 10% marker, 10% asymmetry, as an acceptable sort of benchmark. And what you'll notice in these figures is that after 1 year, they've kind of reached that 10% threshold. They return back to sport, but it takes maybe up to 2 years for them, or even longer, for them to reach kind of their final sort of typical asymmetry level, or an asymmetry level that's typical of their sport cohort. Similarly, even after achieving a low level of asymmetry, one that's reflective of their sport group, athletes display reduced jump performance, in this case jump height on the top and mechanical power output during jumping on the bottom, in relation to a healthy group of sport match athletes. So like I said to you before, it takes a long time, maybe it takes longer than that 9 to 12 month window to return back to your typical asymmetry level. And even after doing so, your sport or your performance level in jumping is still remains reduced. So in ACL injured athletes who return to sport, between limb asymmetry alone may not tell the full story, and that we might want to look a little bit deeper to understand neuromuscular factors that might give us better insight into readiness to perform in an athlete's sport. And that brings into question a slide that you've seen before, is how can we, or what is the appropriate benchmark that we can use to evaluate performance readiness, not just return to sport readiness, in ACL injured athletes. So oftentimes in the C block is where we spend most of our time, where we use the contralateral limb or the uninjured limb as limb symmetry index to decide when athletes are ready to return to their sport. And you might, block B here shows that we could use an athlete's pre-injury baseline data, and that can be nice if it's available, but it's not always the end all be all, because you might kind of bring up the obvious question saying that this athlete has some baseline data and goes on to get injured. Maybe they were predisposed to that injury to begin with, and by returning them back to their pre-injury baseline level, it may be still insufficient. So this leaves us with this block A, which is kind of where we focus most of our time, and then we can use a benchmark from a comparable non-injured control population. But this is complex because that benchmark should encompass multiple different facets that describe neuromuscular performance in different capacities. But also, nobody yet has demonstrated or provided evidence about what that benchmark should be. As an example, what is jump height? What's the necessary jump height for a performance readiness benchmark? And this is recognized by this guy here, Dye, who's a surgeon. And he describes this envelope of function of the knee. He says the knee isn't just an ACL and a meniscus, it's also this complex, complex joint that acts as has concentric force production and eccentric force production, but also has these factors related to stability, and it's a complex network of muscles and passive and active tissue. And he describes this envelope of function as the external load and the frequency of this loading. And we kind of take that approach and apply it to neuromuscular strength, where we look at force output and movement speed, and here describe these different characteristics, these different capacities along this envelope of function for strength. Like I said before, this is important because that way gives us the capacity to measure things like strength, power, and plyometric capacity across the envelope of function, get a little bit more of a nuanced understanding of how athletes move and their neuromuscular capacities, not just concentrically, but also eccentrically. And if you were a strength coach, you would kind of align well with this because the way that you train something like maximum concentric or eccentric strength is completely different from the way that you might train plyometric capacity. So even though these capacities are interrelated, they are distinct and are trained separately. So it's important that we gain some insight into specific areas of this envelope of function and identify where ACL injured athletes may be lacking. So we kind of adopt this approach and we evaluate different capacities along this envelope of function. I think the video is playing, it's just lagging a little bit, but we have this very cool robotic leg press in our lab. We've shown it before, but this robotic leg press allows us to evaluate not just maximum concentric muscle strength, but also maximum eccentric muscle strength. And when this, my computer's just catching up. So when, ignore this slide for a second. So this leg press, like I mentioned before, it allows us to evaluate concentric and eccentric muscle strength. And it gives us this force time curve that's about to pop up. And what we do is we isolate the concentric and the eccentric movement phase in multiple different reps. In this case, I'm showing you one example from the middle of 3 reps. And by identifying the peak in these movement phases, we're able to, like I said before, quantify maximum voluntary concentric and eccentric force. So similarly, we can move down that envelope of function a little bit, and when we evaluate more of these power-based capacities with counter movement jumping, we do counter movement jumping not just with a participant's body weight, but also with an additional external load. We've talked about this before, but simply, and I'm just going to spend a couple of seconds here, is that this gives us a characteristic force time curve. And we're able to then integrate this force time curve to get the velocity of the body center of mass shown in this pink color. And that velocity of the body center of mass helps us delineate the concentric and the eccentric phase of movement in the counter movement jump. In doing so, we can then identify a wide range of variables, including the impulse in these different phases. And on the right side here, you can see there's a small list of the many variables that we could potentially get in these areas that describe not only the output during jumping, but also the strategy and the way that the athlete achieves the output from a counter movement jump. And then if you're thinking more on the plyometric capacity side of that envelope of function, we've developed this test with Nathan Boone, who's in the room. And he presented on this just a few weeks ago, where he talked about repeat hop testing. And the important thing to note here is that this repeat hop testing, we tell athletes to jump or to hop repeatedly as high and as fast as they can. And what this does is it creates this big spring-like motion where you can watch this, the guy, especially in this right video, create and absorb force through the hip, knee, and ankle together in a very fast and plyometric way. So going over those 4 main tests, you can probably already start to think that they describe different capacities, but they have quite a range of metrics associated with them. And here there's 39 metrics listed. And it describes this envelope of function. All these different metrics are important and isolated because we train them differently and they represent a different capacity on that envelope of function. But there's some important questions that this leaves, and then we're a little bit isolated with, or a little bit limited with traditional statistics, is that describing what this baseline envelope of function should be for an ACL injured athlete is challenging. Not only does looking at one metric in isolation probably tell us fairly little, it also is difficult to know what is the threshold of that, say, single metric. In other words, what I said before is, how high does an athlete need to jump for them to reach a performance benchmark? And what this we explored with is presents an opportunity for unsupervised machine learning. I'm sure many of you are familiar with, but those that aren't, this is a nice visual representation where essentially we can take a big unlabeled data set, dump it into a machine, and that machine will look at the underlying characteristics and patterns in that complex large data set and provide you with some sort of output. In this case, you dump a bunch of animals in, and the machine is pretty good at saying, hey, there's some different types of animals, and it might be based on their characteristics, and that some animals have 2 legs, some animals have 4 legs, and so on and so forth. So that brings us to our first study that I'll present today, one of 2, is that we use this unsupervised machine learning approach to establish neuromuscular strength profiles in male and female athletes. So over the last couple of years, we've collected described this envelope of function on just about 464 university athletes, but just under 200 being female. And they're from a range of different sports, including ice hockey, tackle football, rugby, soccer, so on and so forth. So we did do this comprehensive neuromuscular strength testing. And as a little side note that I'm not going to get into too much today, is that we also collect a lot of different psychosocial factors, including their attitudes towards training and their perception of their overall musculoskeletal function. So it becomes a very rich data set. And the listed below here is our precise protocol. But essentially, we test along that envelope of function. We do counter movement jumping, we do single leg counter movement jumping, repeat hopping, and some loaded jump testing, along with maximal strength testing on our pull press. Like I said before, that provides us with many different metrics that describe different muscle strength and power characteristics. In this case, we've kind of been fairly selective and isolated this down to, I'll say in quotes, just 39 mechanical variables. We body mass normalize these variables and scale them relative to an interquartile range. And in some cases, in very few cases, less than 1% of the time, there's some missing data, at which point we impute that based on the mean of 5 years. And this preps us well to for our unsupervised machine learning analysis. So we explore kind of a combination of different dimensionality reduction techniques and clustering algorithms. I won't get too deep into that right now, but if you have a question, feel free to ask it later on. And by looking at this combination, we're able to evaluate the quality of clusters that result. So in other words, how separate are these clusters, or how distinct are different groups of athletes? And so we did it separately for males and females, and we found 3 different strength profiles in female athletes and 5 different strength profiles in male athletes. I'm going to focus mostly or entirely on the female athletes for today, just for the sake of time. But we have lots of interesting findings about the males too. So like I said, there's 3 different strength profiles that we identified in this group of almost 200 female athletes. I'm going to start here with profile 3. So profile 3 is a pretty standard profile. These are athletes that are strong, they jump high, they have fast contraction times, and they have this high level of stiffness, but it's also paired with high strength, like I previously mentioned. So in other words, this is an appealing profile. And we can move here, we'll look at profile 2. Also a profile that we kind of thought that might pop up, which is athletes that have low strength. They have low power, they're a little bit slow, and that kind of causes a lower body stiffness. And then an interesting profile 1 is that these are also weak in athletes, but they adopt a fast movement strategy that is kind of paired with high lower limb stiffness. So they're stiff, but they're also weak. And we don't really know what that means, but there has been some literature that suggests that that could be, I'll just say, an undesirable characteristic that could be linked to something like injury. What we found, and this part is just kind of an observational result and a preliminary analysis is that we also went on to watch these athletes for the next year. We did the study collection over 2 years, and we watched athletes from year 1 in their next season and athletes in year 2 in their next season. And we found that there was 1 ACL injury in this strong and fast group, but 5 total in this weaker population. So it provides kind of an interesting area for us to do some further research in. But regardless, what we can all probably agree on is if you were a strength coach, or a coach of any kind, or maybe a physio, and you had to pick the most desirable profile or the target profile for your athletes, you probably pick profile 3, which is still very strong and fast athletes. And that leads us to study 2, and where we look at neuromuscular strength profiles and see if we can use this as a benchmark to determine performance readiness of ACL injured athletes. So as a precursor to that, we looked at just the healthy athletes I provided you with just now. We looked at those 192 female athletes. We said, can we train a supervised machine learning algorithm to differentiate between that profile 3, we'll call that our target profile, versus the rest of the athletes? So this is a 1 versus the rest approach. We're saying there's 1 target group, and we're seeing if we can differentiate athletes between that group and the rest of them. We trained a variety of different machine learning models and found that our models were very successful, around 98 to 100% accurate, and demonstrated excellent performance. So it's a promising first step, and providing us with the opportunity to explore this further in ACL injured athletes. So we then took 13 ACL injured female athletes. There's 19 ACL injured athletes total, including males. They were just under 15 months post ACL reconstruction. And we did this exact same testing protocol. We evaluated their umbilical function, and we measured strength, power, and plyometric capacity. Then what we did is we take these ACL injured athletes, plug them into the supervised machine learning model that I just presented a slide ago, and we're seeing, hey, what happens, or like which of the ACL injured athletes are going to be classified into our target profile, our strong and fast athletes, and which ones will not be targeted into our target profile. Then we can compare the numbers of athletes who pass this performance readiness criteria versus traditional return to sport criteria, as an example, the limb symmetry index. And what we found was surprising. So focusing here on the female athletes, there was 13 female athletes, only 1 athlete passed this performance readiness criteria using a machine learning approach, whereas the remaining 12 did not. In some cases, were very far away from the performance criteria. And that's kind of in contrast, or in somewhat stark contrast, to the limb symmetry index, where 11 of those 19 athletes, this is combining males and females, were past this return to sport criteria. So what this highlights is that athletes can pass these common return to sport criteria, but be far away from a performance readiness criteria. And using that machine learning approach, we can do a post hoc analysis that kind of helps us understand or get some insight into the decision-making process of that supervised machine learning algorithm. This is called a SHAP, or Shapley values, for those that are interested in that. And I'll give you a second to absorb this figure as I kind of explain it. I start down here at this mark here, which is at 50, 0.50. And what you can see on the right hand axis is that you can think of these as percentiles or percentages. And if I told the model there was only 2 choices, they're in the target group or not in the target group, and you gave the model no information, essentially the model would flip a coin and it'd have a 50% chance of getting it right and getting it wrong. And here we start at 50% accuracy, or 50% likelihood, sorry, that they're in the target group or not in the target group. And then we can look at individual features, or in this first case, a bunch of features combined, to see what features are moving athletes more towards the target class, or the target benchmark, which would be towards the right, or which features or which attributes along that envelope of function are moving athletes more towards the left, or in other words, further away from the target envelope of function. And here we can see that this is the only female athlete who did pass our performance criteria. They maybe barely passed, but still above a 0.50 value would indicate that the model classifies them as part of the target profile, strong, fast group. And, oops, sorry. So a couple of things to note, this is the percent difference from the target benchmark's value in that single metric. And we can then use this to say, hey, even though this athlete passed our performance readiness criteria, there's some metrics or some capacities along that envelope of function that we can kind of hone in on and train specifically to even improve their performance further still. And in this case, this is an acronym for our repeat hop test, and oftentimes most of these orange bars are related to plyometric capacity. So although this athlete passes our performance criteria, there's room for growth and room for improved training or increased training, especially as it relates to plyometric capacity. And you can imagine if we did that, we can move this athlete even further to the right, even closer to that target group or that target profile. I'll give one other example. Similarly, the same plot, this time with a value of 0.39, you can think of this as like 39% chance that they would be assigned to the target group. This athlete is not assigned to the target profile and is lacking similarly in some plyometric capacities, but also in some single leg capacities. So this provides this exciting opportunity for us to, one, use a data-driven approach to identify which athletes have this performance readiness criteria and which do not. But also, you can imagine if I gave you a list or a large data set of how an athlete is performing across these 39 metrics, me included, you can get kind of lost in the details to a certain extent. This post hoc analysis provides us with the opportunity to not only simplify the output for ourselves a little bit and identify only, in this case, the top 10 most important metrics in the model making its decision, but also simplify this output a lot for practitioners. So, you can give this report or this figure to a physiotherapist or to a strength coach, and it will give them a lot of important information in a very digestible way, identifying how far they are away from, how relatively far away they are from a target profile, and what areas are holding them back versus what areas are they excelling, for lack of a better term. So a summary is that this unsupervised machine learning method is a promising way that we can start to establish population-specific, sport-specific neuromuscular strength profiles, sex-specific neuromuscular strength profiles. Using this approach with a supervised machine learning method, we notice substantial discrepancies between return to sport readiness and performance readiness in ACL injured athletes. And the supervised machine learning method has utility for practitioners and strength coaches as it provides them with a data-driven method to identify important trainable neuromuscular performance deficits, not just after an athlete returns back to sport, which is the case that we provided here, but also before, during, and after that return to sport transition. This is, I think, an exciting first few steps, and there's a lot of work that still needs to be done. For an example, we need to further examine the relationship between these neuromuscular profiles that we've established and risk of injury, specifically risk of ACL injury is interesting for us. And secondly, we still need to determine that if by achieving this performance readiness criteria that we propose, athletes are maybe more or less likely to experience re-injury, and or maybe increase the performance outcomes in their sport, which is our main goal. Thanks for having me. Look forward to questions, and obviously thanks to our lab group, all of which have helped me out a lot, and particularly Matt.
Nathan in the back and then Brett.
I was wondering how many athletes were put into each of the groups that you showed?
Yeah, that's a good question. It's, I don't have the exact numbers available right now, but it's essentially, an even split with some small variation.
Brent and then a question on the back.
Oh, thanks. Thank you, Zach. That was really good. By the way, I don't like the fact that we're calling this tackle football, like it's stats football. So I missed it. What is the stiffness measurement? Like, what do you do to do that measurement? And is that a performance metric or is that the injury risk metric?
Yeah, so our stiffness metric, we call it your lower limb stiffness or whole body stiffness. Measured like I kind of alluded to on our force plates.
Yeah.
And it's just the difference or it's the body weight normalized force produced over the displacement of the body center of mass during lowering. So it'd be like the counter movement depth, if that makes sense.
So, well, I think, yeah, so is it kind of like a marker of power production or a person's ability to generate force
It'd
quickly?
be only during the eccentric deceleration phase, so only during the lowering phase, so not as an indicator of like peak mechanical power like you would think of it. Probably more like a movement strategy. That first group that I mentioned before that has low strength and high stiffness. And the way that they achieve that is essentially by having very fast contraction times that's driven by very small counter movement depths. So you have a small depth and normal or high force values, and that results in a high stiffness metric. What means something for injury, maybe some people have proposed it as, or it may or may not. We need to look further into that, but it's I'd say closer to the strategy variable than necessarily a performance or.
Okay, and then just quickly, because I think I missed it, so you do the unsupervised machine learning model, you identify these groups of athletes, and then you kind of did the different model thing to figure out sort of where they fell within the, if they were ready to return to sport. So were you looking at changes in those people's performance in order to look at those, or were you just like, they come in, you measure their performance metrics, and then you just see kind of where they fall?
Yeah,
in your
exactly. So we take these control athletes, they're healthy athletes, we group them into 3 groups. We say one group is the target group, that's the group that we want everybody ideally after you're injured to return to, or to end up in. And I don't really care if you end up in one of the other 2 groups specifically, so we just kind of group them together. And we train a machine learning algorithm that's gonna say that either the athlete's in the target group or not in the target group. And we use that model based on just having our ACL injury athletes come in essentially one time. In reality, these athletes are part of like a detailed ecosystem that we are incorporated with these dinos, so they come in multiple times. But for this study, they come in after, some places very soon after. They're cleared for full support participation by a medical staff member. So medical staff says, hey, we look at a bunch of different things to evaluate return to sport readiness. They're ready to return to sport, and for the sake of the argument, they go back to fully participating in soccer. And right in that window, they come in, do this extensive battery of testing to evaluate their analytical function. We plug them into the machine learning algorithm and say, hey, from a performance standpoint, where are you? Are you the target group or not in the target group?
So there is potential, and then I'll shut up. So there is potential for a person to never achieve the target group.
Yeah.
Yeah, okay, all right, yeah.
We had a question in the back.
You had the profiles, like going back to your first study for males, there were 5 of them.
Yeah.
What were the other 2? I assume the 3 of them were the same as the people, what were the others?
The 3 are, they're similar but different. Here, let me show you right now.
Like, was it just that there weren't as many females with like favorable strength profiles, that's why?
So what we found is that in females, we get these 3 different strength profiles and like there's a spattering of different sports kind of spread across the 3 profiles. With males, we have some that are similar, like as an example, profile 1 here is this weak and slow group similarly. We don't have that weak and stiff group in the males. And we do have the very strong and faster, in this case, profile 5. But we also have a little bit of a sport specific clustering in this scenario where we have a couple, in this case, profiles 2 and 3 that are pretty similar to one another. They essentially demonstrate average strength, average jump height. One's a little slower than the other one, and average stiffness. We have profile 4 here, which is almost entirely all of the ice hockey players in our study. If you know, I'm sure everybody has skated before, you can imagine that they're pretty good jumpers, they're pretty powerful, but they have big braking capacities. So they have big eccentric deceleration, power and impulses. And then profile 5 here, like I said before, is just very strong, very fast, but they are related more to like wide receivers and DBs in football and in, like as an example, male soccer players.
Do the same sports for males and females except for.
Yeah, essentially the equivalent sports, like there's no field hockey for men as an example. The only difference, and we're exploring this a little bit further right now, is that there was no ice hockey players in the female group. Which could explain the absence of that cluster potential.
Madam?
Yeah, I noticed you sort of presented that you studied several different dimensionality reduction techniques, PCA, TC, and then UMAP.
Yeah.
And then a couple different clustering algorithms too. It looked like you presented the UMAP plot, and that's probably, I assume, where you got your groups from. Was that, like, how did you determine that that was your best method?
Yeah, so
What metric did you use to evaluate those algorithms?
you are right, UMAP was the best dimensionality reduction. With a little side tangent is that it was probably a little bit better because this is a most likely highly unlinear data set, and PCA is more of a linear based approach. So UMAPs are just how close individual data points are to one another in a feature space, and then you can reduce that feature space down and say close data points in the original feature space should probably be close to each other in a smaller feature space too. So we explored, like I said, I think 3 dimensionality reduction approaches. They have different hyperparameters in there too, so there's many different kind of combinations, along with 3 clustering algorithms. And then on that slide, I showed that we evaluated them using kind of like cluster quality metrics, primarily the silhouette score, which describes how how separated those clusters are.
And then follow up, were the clusters identified by each method very different, or were there similar stories in your profiles?
Yeah, similar stories, like as an example, I mean, in some instances, one particular combination might lead to something that's just a poor clustering outcome. In the options that were, I'd say, appropriate or similarly good, it would be maybe as an example, only 2 clusters instead of 3, but those, when you explore it a little bit further, our version has one of the clusters is just subdivided into multiple different facets, which might provide a little bit more nuanced understanding. So we use cluster quality metrics combined with some knowledge and some our interpretability of the biomechanics to kind of create a final
I guess similar question to Adam, so for your post-hoc analysis, where you use SHAP, did you consider to use other metrics to, like something like a random forest feature extraction to see which was the most explainable feature?
Yeah,
Did you
so
find similarities between SHAP and other models?
So what we did is that, like I mentioned before, we trained 4 algorithms, in this case for the female athlete benchmark. They all perform pretty well. In this case, the support vector machine was the best one. I use the support vector machine in this case to then predict whether an athlete was in the target group, not in the target group. But in order, keep in mind that we have multiple other male scenarios. So in order to maximize the interpretability of our SHAP plots across different benchmark scenarios, we use the random forest classifier, because SHAP works well with random forests in all cases. So in this case, instead of nearly 100% accuracy, it's 98%, which is also very good. It was appropriate to then apply the SHAP values to the random forest. We also explored a couple of different, like 2 or 3 other explainability algorithms, alternatives to SHAP, and essentially pretty similar outcomes. Obviously, they're a little bit different. There's not much of randomness in those, but essentially the same story pops up over and over.
And then just one follow-up, so if you use those models and you identify limitations in single leg features, like you have plans to do any type of follow-up to say, okay, if we train this athlete's single leg power, can we put them into or create an ideal athlete, or bring them from one condition to the positive condition or the positive.
Yeah, so I think that's like an obvious next step. For us, like I mentioned, we have 13 female ACL injured athletes. And I'd say when we look at these SHAP values and get a little bit of a deeper understanding as to how the machine learning algorithm made its decision and what factors along that envelope of function are deficits versus pros. There's like 3 main points. One is that some athletes are very far away from the target profile, in which case their specific strength characteristics are probably not all that meaningful. They just need to train across the whole envelope of function in general. And then 2, in athletes that are a little bit closer to that target profile, it's highly individualized. I showed a couple of examples of athletes that are more plyometric deficit, but there's other athletes that have different characteristics that need to be trained. So it is highly individualized, which is one of the benefits of this approach for practitioners. And 3rd, if you had to pick a couple of different metrics, we had identified that would be a plyometric capacity tends to be lacking, and also single leg strength capacities, jumping capacities seem to be lacking. So that is an obvious next step. We're not going to probably do in this scenario because it's hard to keep track of those ACL injured athletes over, maybe especially in the university environment where some of them are in their 3rd or 4th year and are leaving. But I think that as a next step, that would be probably very helpful.
I have a question kind of related to that and related to a question that came up for the males and your different profiles that were decided. So a lot of the court sports were in the first 3 profiles for those. Based on that results, like if it's almost becoming sports specific, what your profiles are defined as, would you ever change what your target population becomes? Because I would think that some court sports are just characterized by those kind of movements, and so maybe they will never reach your target population as you've defined it. So would you ever adapt this to?
Right, so in the female group, there is only one target profile. You'd agree that you probably don't want an athlete coming back from ACL injury or any injury for that matter, and ending up in a slow and weak cluster. So there is only one target profile, it's a strong and fast cluster. In this case, for the males, there's multiple different target profiles you could potentially want. If you were, like I'll just simplify it, if you were an ice hockey player, of course, you would rather be in the ice hockey sport-specific profile that has these big braking capacities, rather than being in, say, profile 5, which is more wide receivers and soccer players. So you do have multiple scenarios. I've only shown the females here to simplify it a little bit, but in reality, including the female athlete profile, we have 4 other profiles that would be male specific.
Venus and then Micah. I think you might have answered already. I was going to ask you about if you found similarity when you classify an athlete that is not ready yet. So did you find similarities that the parameters that were deficit, like they showed deficit in one, it wasn't common to the other?
So
And then a big group?
Sorry, it's highly individualized, but it's most common, if I had to distill it down, that plyometric capacities and single leg capacities are the ones that need to be trained out a little bit more on average.
And did you give weights in your models to some parameters compared to the others? I don't know, I don't understand really how you did it, but did you like one parameter is more important, maybe that the strength is more important than the other? So did you give weights in
Yeah.
your model to the different parameters or not?
We didn't do that, and part of the reason is because like in the strength conditioning and rehab world, different people might have different opinions about, you know, what are the most important metrics, what are the most important variables, like I showed here is that we have it, like, in this case, we've distilled it down to only 39 metrics that describe this whole vocal function, but you know, you can endlessly read about strength conditioning coaches arguing with one another about what metric is more important than another metric. And in reality, it's probably a combination of multiple ones that are important. So we didn't provide weights in the model. What we did is that the model can select however it wants to select its best predictive capacity. We looked at the best predictive model. But all we care that the model is good at, in this case, for the supervised machine learning side, differentiating between the two target groups and the non-target group. In our clustering output, I didn't show, but we then can also, we did some post hoc analysis on these as well. Or like, let's see, hey, in these three groups, what are the most important metrics that describe, or maybe like, you know, kind of alluding to your question, what are the most important metrics that describe function in profile 1 versus profile 2 versus profile 3? We summarize that in this figure here, essentially. So something like, as an example, something like stiffness, maybe it isn't as much on somebody's radar as jump height, but turns out to be an important factor for one subcategory of athletes.
So when you say stiffness high, the one high, so is it normalized to something? Because it's just the body weight over the how much the center of mass moves, but do you normalize that to the something? I don't know. Because it's just if somebody is bigger, it's just it will be higher. They move the same distance. So
yeah, so all these metrics are all body mass normalized, so that actually I think should account for that factor. And then in terms of the data set as a whole, we scaled all the variables so that the scale of, say, jump height won't influence the scale of stiffness when we're clustering or when we're using other supervised machine methods.
question for Maika?
Yeah, I was curious for part 2 of your study that you did, in order to kind of determine the percent of maybe training readiness, for an individual. Did you see the metric inputs, differ between males and females, or was it sport specific as to what is determinants of how likely someone is to be classified into like your typical or your preferred training profile?
Yeah, so that's kind of this plot here. For the females, we can't say if it's really sport specific because only one athlete successfully managed to get into that high performance target group. And the males, I also kind of say similarly. This is a little side tangent that we can talk about later if you're interested in, but we only had 2 out of 6 athletes come in, so we didn't meet that performance criteria. So I don't think that you can kind of categorize like maybe soccer athletes are being more successful in reaching the performance criteria versus rugby or hockey athletes. Essentially, I think the main takeaway from this aspect of our work is that most athletes after a return to sport, no matter what their sex is or no matter what their sport is, are very far away from reaching what we would call like a high performance level.
Reza and then Nathan. And then Reza.
Thanks for your presentation. How many data do you use for training your model? How many do you use for this?
No, we use the 70-30 training testing split.
Just one set. Just
No,
one set.
we just totally blanked on what this was called, but we didn't do like maybe a common method would be 5-fold validation, because we have a pretty big sample size, but machine learning, it could be bigger, obviously. We trained that, or we did as many folds essentially as you could by using a single athlete in the testing set every time as the valid, or it's like the validation. Person as a fold, that all makes sense. There's a name for it, I just can't remember.
Yeah, so your population is 126, yeah,
192
190.
for the females and 464 total for males included.
So what's these numbers in 19 and 13 that you?
So these are the ACL injured athletes. So you can train these models on healthy athletes and then apply them to ACL injured athletes. One of the general problems of ACL injuries and researching them is that they're common, they happen often, but you know, there's still like a relatively small number of ACL injuries that occur. So 13 ACL injured females is quite high, so it's a lot of ACL injuries that happen. So collecting 13 is great. Obviously 13 by itself isn't really enough to do any sort of interesting machine learning, and that's one of the benefits is that we're able to leverage a big university population, like I said, almost 500 athletes, train models of this big population that will only continue to grow over the upcoming years, and then apply those models that are trained on a good population size to individual ACL injured athletes, kind of like getting the best of both worlds, where we get the benefits of machine learning in this case with small sample sizes or quote unquote small sample sizes of ACL injured athletes.
So if your models have been trained based on healthy athletes, then how can the models predict ACL injury? You know what I mean?
I understand what you mean. Just to clarify, we're not trying to predict ACL injury per se. When we have these models that are trained on healthy athletes, what we're doing is saying, what does that envelope of function look like in healthy athletes? And are there different types? And we say, yeah, there's in female athletes, 3 different profiles of that envelope of function. So they show different types of plyometric and strength capacities. And so it's like the question that it would be like if you're a physiotherapist as an example, and you had an ACL injured athlete come in and you do a lot of different strength training and rehab exercises, and every week that the person comes in, they ask you, like, am I ready to go play soccer again? Am I ready to go play soccer again? And you say, it's very hard for me to tell. How do you tell? And you know that we want them not only probably to be symmetrical, that would be nice if their legs were, if their limb asymmetry was low. But we also want them to be able to perform well, like, you know, that probably jump height's important. But how high do they need to jump before you say, yeah, you're able to perform at a level that's similar to the high performers in your sex or sport? So that's what we did here, is that we used that unsupervised machine learning method to essentially establish a target envelope of function. So that when that person says, am I ready to go? You say, well, you are in this area of the envelope of function, but you're still lacking in this area. And it's hard because that envelope of function is made up of 39 metrics. So we then leverage this supervised machine learning method to then say, hey, instead of looking at each individual 39 metrics that describe that envelope of function and saying like, you need to work on these, but not these. Instead, we'll use a machine learning method that we can plug in an ACL injured athlete and see, do you look like a high performing healthy athlete, or do you not look like a high performing healthy athlete? Instead, you look like a low performing, still healthy athlete. And in this case, then you say, hey, we want you to look like a high performing healthy athlete, but you don't yet because we need to work on these 3 things. And that's in this area of the envelope of function. So you might tweak your rehab or tweak your training protocol so that instead of focusing on these guys, which you were doing before really well, now you're moving up into these 3 most important metrics and saying, hey, we need to do some more plyometric capacity and single leg strength work. Does it make sense?
Yeah, and last question, yeah, thank you for your explanation. So that SVM 100% means that all 13 or 19 were related correctly.
Yes, we don't know. Like for ACL injured athletes, when when we plug them into the model, we don't have like a right, wrong answer. We're seeing what does the model tell us about this athlete? Do they look like a person or do they not? Or how that target athlete or not? In this case, now we're like the step before where we need to make that model and train it on the healthy athletes to begin with. So if the model couldn't tell the difference between a strong and fast athlete in the target group, a healthy athlete, and a slow and weak healthy athlete, then it would be kind of like a mute point, and we then probably throw the rest of the garbage and I put my PhD or something, but in this case, luckily it can, so it's 100%. We've looked into kind of the way that the sport vector machine works in this instance, differentiating healthy athletes, and are pretty confident it's not, well, we can verify this in the upcoming years, but not overfitting to our sample. It's just a pretty easy classification problem for this sport vector machine. So it's pretty good at telling strong athletes from not so strong athletes if they're healthy.
Okay, Nathan and then Benno.
For the pie chart slide that you had up there for the males, I was just wondering what target group you selected for the males to classify that, did you meet that or not?
Males there's 6 males here. Of note, there was no ice hockey players in this group. That means that, you just trust me on this, there's 3 potential target groups, so it's different for each of them. Or not different for everyone, because there's 6 athletes, but it could be different for all of them. Here, there's 2 athletes that were cleared. I can go in deeper into that if you want me to, but this might be overestimating that value.
And then what did you use for limb symmetry index?
This is an amalgamation of multiple different metrics. So we looked at limb symmetry across what we call the common force plate metrics that a practitioner might use. So we looked at like things like impulse and during jumping and strength on the our leg press. And this is maybe one metric is 10 and another metric is 12, essentially combines down to
Benno?
So you have probably the most data in the world about
yeah,
the question at hand. Is that correct?
is what correct? Sorry.
Is that correct that you have the most data? Anybody have as much data as you have?
Well, I'm sure other people have more data than I do, but we have a lot of data.
Who works on that?
In our field, as far as I know, this is probably the biggest university athlete strength data set that I'm aware of. That looks at multifaceted variables across our envelope of function. There may be others that are bigger, but have only looked at something like exclusively jump height. But we have, I'd say, one of the biggest that I'm aware of.
So you basically give that information to the coaches that they decide which factors they rule, correct?
We work closely with the dynos in general. We work very closely with the medical staff and then also have links with the strength and conditioning coach, Rich Hatskill, who's the head strength coach. And he then distills that information down to us, and we also talk to the sport coaches as well. So we're able to like share that information across medical, performance, and sport specific domains, I guess, of athletic performance.
How do you analyze what they do?
No, after we'll like help the medical groups make decisions if they come and kind of ask us about that as an example. But we don't have our hands in the pie of say strength conditioning side. Like we'll share that information with them and identify like, hey, this is sort of like the outcomes from our current projects. And then it's up to them to apply it in a way that they see.
But wouldn't that be a validation of your quality?
Yeah,
You should talk to your supervisors.
yeah, he's right there.
No, I think, you provide information, they make, based on that information, they make decisions about an athlete. And it should be easy to quantify whether these decisions are the right ones. And where the model is strong and where it is not strong.
Yeah, I totally agree.
Because it's great. Up to that point, but you can do much more. When do you finish your PhD?
Hopefully before we figure all that out, but.
Okay, I'm gonna pose a hypothetical. Let's say I have a son and he's 15 or 16 years old and he wants to play hockey, wants to get a scholarship to a university in the States or something. And he gets an ACL injury. And the average time to return to sport is 9 months. Or something, I think you said.
Sure,
But it seems like these performance envelope metrics are much more conservative than his limb symmetry index. 9 months is a whole season for a developing child. Like, that's a death sentence, and I could see 2 seasons be like, there's no way. So, okay, so actually, it's your hypothetical. It's your son, he wants to, do this. He's not meeting the performance benchmarks. And he's not gonna be an elite player if he takes off more than 1 season. So what do you do?
I think it's a decision that needs to be made on an individual basis, because on the same note that you're saying you don't want him to miss 2 seasons. Well, probably 2 ACL injuries is also probably a pretty poor outcome for his development. So you do want to avoid that scenario entirely. So I would say that, we're not saying here that everybody, here we have 13 females and only 1 of them should have ever returned to sport. I don't think that that's our outcome. Our outcome is that there's a discrepancy between when you're ready to return to sport based on conventional methods and when you're performing like what we call like a high performance strong athlete, like a target group. And you can perform, I have some other slides here too, but going back to this slide, you can get cleared for return to sport. Maybe I would say, hey, it might be beneficial to take more of a conservative approach. So instead of 9 months, maybe we can wait 15 months or maybe a little bit longer. Take a more conservative approach, make sure that they, we're evaluating and measuring what matters in terms of their health and performance and their rehabilitation. But then they return back to sport, and based on this graph, over 2 years later, these athletes have all returned to sport, but their performance is still low. And who knows why that might be, but we have another paper that kind of highlights that it does take, 3 to 5 years to get up to that previous, back on your performance trajectory. So what we can do though is maybe use the methods that we're proposing here to do a better job of informing and using a data-driven approach to inform the type of training or the areas that those athletes should be focusing on. Once they've returned to sport, I'd say taking a conservative approach, make sure that the athlete is, not returning too soon, for sure. Then they return to sport, and we use a data-driven approach to monitor them not only before, but during and after that return to sport transition to make sure that we're informing their training in a way that is individualized to them.
We have an online question.
Okay, there's a question before we go to ask you the questions. So are there any assessment or metrics that you would take out to maintain the same profile classification? Or what would be a minimum input to maintain the same profile classification?
Yeah, that's a good question. We've looked at a little bit. What I can tell you is that maybe we've looked at this from 2 different standpoints. One is that we have this very cool leg press that lets us look at maximum concentric and eccentric strength, but almost nobody else in the world has this. So this is a relevant question for, say, practitioners or physios, because they're saying, hey, strength is an important part of this envelope of function. It's included in your model. I love to use your model, but I don't have a leg press to measure these metrics. So we're going to explore, and we are exploring right now, what happens if we remove those. My hunch is that if we can still perform very well without those metrics. In a separate analysis, we're kind of building off of this concept and looking at what happens if all we did was body weight counter movement jumping. what I can tell you is that if all you did was body weight counter movement jumping, you start losing some of the nuance that we have with this multifaceted approach. And what happens is that you can still have pretty good prediction accuracy, maybe around 80% accurate, a little less than 80% accurate, which is pretty good still. But in terms of distinguishing these groups, it becomes a little bit more difficult, and especially if you're looking at something like ACL injury, you'd like to have that prediction capacity as high as possible, and 80% might not quite cover.
Okay, that's great. Now, Walter, go ahead. It's your family. Your turn now. Walter,
Okay, yeah, great. Yeah, can you hear me?
very loud and clear.
Okay, great. Yeah, so I have a couple of questions, Zach, and thank you for the presentation. Enjoyed it very much. I was curious, do you think that return to sport success and return to sport performance depends on the sport that you're in, or you think it's about the same independent of the sport that you're in?
Yeah, I think it probably does depend on your sport, and probably even more specifically, it might depend on the position that you play in the sport. You can imagine that, like if I was an NFL player and I was a wide receiver that needs to be extremely explosive, repeatedly, and we know that something like rate of force development with quadricep is delayed in terms of its adaptation after ACL injury, then that would probably play a bigger role, or potentially could play a bigger role in comparison to somebody else, maybe like a swimmer, or maybe like an offensive lineman on a football team as well. So I think it's multifaceted and probably fairly complex.
Yeah, the reason I was asking is because, you mentioned football, and in football, it's quite clear that you need your ACL for cutting maneuvers and so. But in alpine skiing, people have said you injure your ACL in alpine skiing, but as long as you're properly in controlled ski, you actually don't need it at all. And so I was wondering whether or not the success, to perform to pre-injury performance might be better in a sport like skiing compared to something else. But obviously not based on your answer, I guess.
I'm not sure.
Yeah. The other thing that I had about the muscle properties, sometimes people have argued that ACL injuries might also be in some sports an overuse injury and occurs more often when people are fatigued. Do you have any assessment of muscle fatigability at all in your scheme?
So I agree, I think that's super interesting. As a side note, we're looking at that kind of in a separate study that we're doing right now, looking at how ACL injured athletes versus healthy controls fatigue after ACL injury. But we don't have an assessment of fatigue in our envelope of function, which would be an important or an interesting addition. It's just feasibility wise becomes difficult because we have a short testing window that we're able to test these university athletes in, and inclusion of fatiguing protocols obviously takes a little bit more time and more resources that would be difficult to include in the study.
Yeah, I remember Matt used to have this test, I guess, where he did 20 maximal vertical jumps, every 4 seconds or something like that. And they always like that, to see the decrease in performance over that testing. But I guess it does take more time and then fatigues you, and then you might not be able to do anything else.
We're using that protocol and others, but in a different setting.
Yeah. The last question that I had was, when you measure force or strength or peak power, it depends very much on the speed that you do it, on the angle that you do it, and so, for example, in peak power or peak strength, you might test one athlete, and at a certain speed, that athlete A appears stronger than athlete B, or seems to have a bigger power output than athlete B. But when you test at a slightly different speed or a slightly different resistance, you actually get exactly the opposite result. And I was wondering how you justify that. Is it, or in other words, is it proper to test everybody at the same speed and at the same angle for strengths when that might actually not really be optimal for one person, but might be optimal for another person?
Yeah, I think that's an interesting question. On our leg press, we standardize as kind of like foot placement as an example. So we standardize as much as we can. one of the benefits of our leg press is in comparison to some, like, as an example, if you went to the gym and did 1 repetition maximum squatting to measure your, like, strength, is that our leg press allows you to make your peak force or your peak display or your maximum strength at any part of that range of motion. So Walter, if you were a little stronger in a deeper range and I was a little stronger in a more extended range, we would capture both of those aspects, which is kind of nice. There's some pros and cons to that approach, I guess. And then in terms of different movement velocities influencing the expression of strength, I would say that we don't explicitly capture that with our leg press because we do that close to isometric values. It's like pretty slow, close to 1 repetition maximum values. But
Yeah.
what we do probably get a little bit of insight in is how would people display that across the rest of the umbilical function using loaded jumping, unloaded jumping, and plyometric testing as well.
Yeah.
To a certain
Great,
extent.
thank you. Yeah, thank you. I enjoyed that.
Alright, so with that, we'll thank Zach, and I just wanna make a quick comment before that. So Zach presented just about a year ago in the seminar as well, and he volunteered to present again when we had a cancellation. And he's made a lot of progress, he's even had some hypothetical sons, and Zach's been quite so let's thank Zach with that.